to my channel. So today I'm not really fixed up or anything. I just kind of wanted to make this video because I had a little moment to shoot. If you haven't seen the video is called 7 month post exosomes doctor follow-up. I'm sitting in my room and I'm letting you guys know how my doctor appointment went. If you haven't watched that one yet, watch that before you watch this, because I think it's kind of, it's not super, I guess, relevant to what I'm going to talk about, but it kind of tells you what kind of headspace I was in when this happened at that same appointment. So it's probably good to know, that's kind of the part one, and this is sort of the part two of that video. So, sorry, my throat is like really dry. It's very hot. It's still kind of hot out here in California. But, I had that appointment with the doctor. It was disappointing, but for whatever reason, it didn't sink in. The things that she was telling me, the fact that I would have to possibly repeat the entire exosomes treatment all over again, spend that money all over again. I just kind of sat there and didn't really know what to say. I feel like that happens to me a lot with this doctor, where she'll just say something like that I didn't expect, and I don't really know what to tell her or what to respond to that. And she did tell me, she's like, it's a very long process. It's a very gradual process. It's, whatever. And at this point, I'm basically on my 8th month post exosomes, and I have seen minimal, if any, improvement. But I'm still being patient, and I'm telling myself, wait a year and see where you're at after a year. And I think she's also waiting for that year to pass to decide what the next move is going to be. And sorry about all the noise and stuff. The windows are open up here because it's hot upstairs. So that was kind of, you'll hear about that in that first video. I was in there for a while. We were talking for a while, and then I showed her all the issues, all the bruises, all of that stuff, and I wasn't getting anything from her. But for whatever reason, like I said, I was just totally like I don't know. I couldn't respond to her in that moment. I'm not very quick on my feet is one thing that I've noticed. It takes me time to process what I'm like, the information that I'm given, and then to later on come up with some kind of a response. So I walked out of the office, and this is where the story starts. She has an administrative assistant. I don't want to give out her name, but her office person, she's really, really nice. She's actually been pretty patient with me because I have, she's kind of the intermediary between myself and the doctor, and she's been pretty patient and really good about stuff. Because obviously sometimes we can be a little bit short on patience with each other, myself and the doctor, and she's the intermediary. And I had noticed that she had lost some weight. She's very, very overweight. She's tall, but she's very overweight. I would say she actually told me what her weight was, but I'm thinking it was close to 400 pounds. And I noticed that she had lost some weight, but I didn't comment on it because I come from a family of, you wouldn't know by looking at me, but I come from a family of very overweight, obese people. I know there are people out there that don't like that word. I come from a family of fat people, of very fat people. And so we've learned not to make comments and not to say anything, regardless of whether somebody's losing or gaining weight. And so she kind of started talking to me. She was very excited. I noticed that she was very excited. She seemed very happy. When I came out of the office, she was talking with someone else there in the office, and she was very upbeat and very happy and very excited. And, I noticed that they were talking about her weight. And so, as I was, checking out of my appointment and paying for my appointment, we kind of started talking, and she started telling me that she had had gastric bypass done. And she's already started losing weight. She started losing weight before the procedure because of the diet that they have to do prior to the procedure. And she was just super excited. The procedure the procedure itself wasn't too bad, but you know, the aftercare and all of that, you know, seemed a bit brutal, but she was very excited because she was already seeing results. And so, you know, I mean, she was just so excited. I've never seen her so excited before, but I never particularly noticed that she was sad or upset. Um, I guess, you know, some people don't really wear their heart on their sleeves. I'm kind of the same way. Like, I don't really show much emotion, which that might not be the case for this video. I'm already getting a bit choked up over it. And so, you know, she was just, you know, to sort of see that contrast, you know, of her just being, you know, her everyday self, how I've always seen her, to being extremely happy, um, just talking to me. You know, we've had you know, small exchanges, but we've never had like an in-depth conversation. We're actually the same age. I found that out when I did the exosomes treatment because she was there the 3 days that I did it. And she, you know, we found out that we were both born the same year, so we're the same age. She has a daughter. She's divorced. I'm also divorced. So we have a lot in common. We have all of these things that, you know, we have in common. And so I think maybe that's why she felt like talking to me, you know, and I was, you know, I was kind of interested, you know, because like I said, I have um, a lot of I mean, I have people in my family that have died from obesity and, you know, complications related to being overweight. Um, so she showed me the incisions, you know, she was just so excited, and I could see this excitement, you know, and I've noticed even with other people, you know, people my age, when they have something good happen, you know, they're excited, and it's kind of foreign to me, which is, I think, why I wasn't really processing. You know, I had just come out of the appointment, and that was kind of one blow that that hadn't registered yet. And then I was talking to her, and there was all of this information coming at me, and, you know, I was empathizing with her and telling her about, you know, my mom and her struggles with weight and all the other people in my family. And finally, you know, I left the appointment, and I got in my car, you know, and drove home. It was weird because I felt, I guess, numb is how I felt. I'm assuming that's what it is. I felt very flat and very even. Not, I really didn't have like any emotion either way. I wasn't sad. I wasn't happy. I wasn't, you know, I think there was just so much that had just come at me that I wasn't really registering what had happened. And obviously it takes a while. Later that evening, that's when I started feeling really depressed and really upset, and I just kept thinking of that conversation I had with her. You know, I was processing what the doctor had told me, but for whatever reason the conversation with her started hitting me a lot harder. And I think what I realized was that, you know, she is seeing results, immediate results. And gastric bypass is dangerous. I know that my mom considered it. She was actually going to have it done, but because of the risks, she decided not to go through it. This was a very, very long time ago when my sister was little, and my mom was concerned that something might happen to her, and my sister was still too young, you know, to kind of care for herself, I guess. And, you know, she started, sorry, I totally blanked out. That's, you know, every time I think of this, you know, my mind just starts kind of like short circuiting because I'm consumed with emotion. But she started seeing results right away. She weighed the risks and the benefits. The benefits outweighed the risks. It's a much safer surgery now than when my mom was going to do it. And she has a young daughter, you know, so she was like, I have to do something. I mean, she was losing weight even before she did the surgery because of what kind of prep she had to do. And everything started falling into place. All of the pieces started falling together, and I was like, I'm here. I am 8 months out from this treatment, seeing nothing but feeling sick, having pain in my legs, seeing these ugly bruises on my body, still having issues, neurological issues, worse neurological issues than I was having prior to the treatment. And here she is. It was a horrible, she said it was horrible right after the surgery, but immediately, I could see it. She started losing weight right away. Um, she is seeing a future. I think that's where her happiness is that she's seeing a future that she's going to have. And I'm not seeing that. I'm not seeing that that's going to happen for me. And it's really scary. It's very frightening to, because I couldn't understand. Obviously, you're happy because you're seeing results. But again, it was like I couldn't comprehend it. And a lot of times when I see people happy about something small, maybe like an accomplishment at work or something, an accomplishment with their hobby, I don't understand. Like, I don't get it, and I think that's when it sunk in that, she's seeing the possibilities because she did talk to me about her divorce, and how difficult that was. And that's kind of where she started spiraling. She actually got pregnant when she was having issues with her husband. She had not been able to get pregnant. I think she was married for 10 years and had not been able to get pregnant. And then she got pregnant, and her marriage, was already like falling apart. And then she said that's when her weight really started to just, take off a lot, and her self-esteem dropped. And she said, we're all accustomed to comments, and just because I'm skinny doesn't mean that I don't get comments about my weight. I do. I do get comments. I've gotten comments about my weight even before I was sick. And she said, I would laugh it off or just brush it off, but then in my room I would just secretly cry. She said, and I was not, she told me she wasn't like that before. It just got worse after her pregnancy and her divorce and all of that. And she said, I just couldn't do it anymore. I couldn't, I would just go and cry in my room quietly without anybody knowing. And it was just, I started to understand why she was excited. She was seeing a future. She was seeing maybe the end of hearing these comments, maybe a new relationship. Maybe she would move on, and have a different life. Even, even though we're kind of, we're not old, but we're older. We're heading towards 40. And I think that's what she was seeing, and that's what she was experiencing, is the doors were going to open. She did have pain as well, and the pain, she said, it's improving. She said, I couldn't even sleep because of the pain in her. I think she had sciatica. And I'm like the opposite. Like, I'm just getting more pain as time goes on. I'm sitting here and my left leg is hurting, my left knee, my left, kind of like my hip joint, I guess. And it's just like, what's going to happen? What's going to happen to me? Because now the doctor's telling me this other thing. I'm not going to do this treatment again. If it made me sick the first time, what's the difference going to be the second time around? I already threw a lot of money away, which again, I haven't told you guys how much money this was. And here I am worse off than I was before, and I can't even go back on my medication. It was hard. That night was hard because it hit me. Everything hit me like at once. First, the situation, the conversation I had with her, and then this other possibility that I would have to shell out this much money again, to do this again, to put myself through this again, that hasn't really even, nothing has come of it. So it's been hard. Right now we have company from out of town. They actually left. I was very relieved because they left. They went to, I think, a casino or something for the day. And I just, hearing comments, it's my mom's cousin. She was like, oh, you need to travel. You need to get out. That might, you might forget your illness. You might start feeling better. And it's just like, if only it was that easy. If only it was easy to just walk out of the house and that would help. And it actually lately has not. I have actually noticed it's been harder. When I go out to the swap meet on the weekend and walk around, it's starting to cause pain. Um, Laying down, I was laying down last night and my legs were hurting. I mean, I don't even have to be on my legs for them to hurt now. So it's been a lot. All of this has happened. I saw my doctor, what was it, last Tuesday? I think a week ago I saw her, because today's Tuesday. It's August something. I'm sorry, September. I think it's September 12th or 13th. I don't even know what day it is. So it's just been rough. And to hear these comments and to know that I can't has been rough. And I knew that this video was going to be hard. You guys, I know that I don't like crying, that I don't like making videos like this, that I really fight it a lot. Even in therapy, I fight it. I hate crying, but I think it minimizes the experience of this illness, because I think that's a big reason why a lot of times people will comment and say, oh, have you tried this? Have you tried that? Because, well, I'm just sitting here on camera being, talking and being, I guess, professional, or, just getting straight to the topic. But it really is a lot more than that. I am right now sort of, again, I'm not counting my chickens before they hatch. I'm going to wait a year. I have to see where I'm going to be after a year. Maybe by some miracle things will turn around in the next 4 months. I don't know. But, I kind of can already tell, that I'm not saying that this treatment was a mistake. I don't know what it was at this point. But yeah, there is that possibility that this could kind of be the beginning of the end, or it's just, things might just get worse, because they aren't getting better. I mean, any improvement that I've seen has been extremely minimal up until this point. So like I said, unless things suddenly turn around, which I don't think so, there's no treatment. From my experience, there's no treatment where things suddenly turn around. Even with my IVIG, it took, a year, like, just to stop having diarrhea and just for my eczema to calm down. And then after that, it still took several more months to resolve. So yes, it can be a long process. But, I think that hopeful feeling that I had at the beginning is gone. If I do experience any improvement, it's going to be modest, very modest improvement, and not what I was hoping for. And I think, the doctor, she's holding her cards very close to her chest. She's not letting me know what she's thinking, with the exception of her telling me that I would have to repeat the treatment over again. That's kind of my only clue at this point, that things may not be going the way that they should be going. She had not mentioned that. She did mention that there may be follow-up treatment, that I may need to do more exosomes, the possibility of intranasal, even the possibility of doing another, intravenous infusion, not repeating the entire 300 billion, 3 bags of exosomes. That was not something that was discussed, or that she even told me was a possibility prior to this, which is absolutely ridiculous and absurd. So I've kind of, the sadness is still there, but I've also moved on to anger. I am very angry, and I am considering the possibility of contacting the researcher, the scientist guy that this is his product, because he has contacted me before. We have been in touch, but I tried not to communicate too much with him because of my doctor, because I wanted to be careful with that situation. But now I'm kind of at a point where it's like, I almost don't even care because I'm already in pretty deep and I'm not getting answers. I'm not getting straightforward answers. They probably don't even know the answers. I get that. But they should know more. They should know more than what I've been told. They should know a little bit more, given that this is something that they're more familiar with, especially the scientist who's dedicated his life's work is researching stem cells and exosomes, and how they can repair different types of issues. I mean, his area of research was spinal cord injury, stem cells and spinal cord injury. So I have a lot of neurological issues. I mean, that's kind of somewhat in the same wheelhouse. But yeah, I just want to leave you with this video. Hopefully I go through with it and upload it because, like I said, this is not something, I don't like people seeing me like this. And I don't want to scare you away from this treatment because, again, we don't know. There's still several months before I reach a year. And things may go differently for you. But I also want to sort of be like a, what do you call it? The phrase is eluding me right now, but sort of like a warning to people out there that are considering this, that things may not turn out exactly the way that you hope, and you may not get the answers that you're looking for from your doctors. So that's what I have for you guys for today. This one was a rough one, but I think sometimes it's necessary to be honest, to be this honest, when it comes to our illness and these types of treatments. So that's what I've got for you guys.